All right, folks, we are here at the Red Pill Expo, and I am with one of the speakers, Dr. Manuel Aparecio Alonso, and he has some very unconventional treatments to talk about that the government has been demonizing, the medical establishment has been demonizing, but he says that in his practice in Mexico, he has seen phenomenal results. Doctor, thank you so much for being with us. Tell us a little bit about this chlorine dioxide. What have you seen in your practice treating COVID patients?
Well, chlorine dioxide is a gas that dilutes in water, and it's helping a lot of people, of COVID-19 people. I represent ClO2, which is a World Health Coalition, where we are more than 5,000 doctors in 25 countries who are working and treating patients of COVID-19 with CDS, chlorine dioxide solution, with, at all bases, an effectiveness of over 99% in all countries, all races, all attitudes. That means no changes, and we have the same exact results. Many doctors.
Well, you know, the FDA is telling us that this is poison, that it's toxic. Where's the disconnect?
Well, the FDA is not saying the truth about chlorine dioxide. They're mixing it up with another substance, which is sodium chloride, which is the salt that makes chlorine dioxide, but it's not the same substance. Chemically are completely different substances. And so what the FDA states on their official webpage and the warnings are about sodium chloride and not chlorine dioxide. I have a special talk that talks about this with scientific evidence that none of the 9 things that the FDA states are caused by chlorine dioxide. The opposite, totally the opposite.
Wow, and I guess this wouldn't be the first time that the FDA has deceived the American people and has been wrong on something critical. And so you talked about, you know, this is a global thing. There's an international movement. Tell us about kind of the movement that's coalescing around this. You mentioned there's a doctor in Switzerland. Tell us a little bit about the global aspect of this.
Yeah, this started in Ecuador with a study of a group of doctors. They're called the IMME. It's a group of doctors of alternative medicine who started to treat COVID-19 patients with this substance. And they had an effectiveness in 5 days of 97% in that days. That was in March and April last year. So that caught our attention, and we formed ClO2 on May 2020 and started to gather all the doctors from all over the world. We are mainly represented in Latin America, but we have also representation in Europe, in Austria, in Germany, in Spain, in Czech Republic, in Japan, in Indonesia. We are in over 25 countries. So we are working all together to give people the best solution in this absurd pandemic.
Wow, yeah, and those numbers, I mean, that's way above even the ivermectin, hydroxychloroquine, the drugs that we've heard so much about. Certainly, this vaccine, there are some serious questions from the doctors that we have talked to. How do people learn more about this? Is there a website people can go? And tell us, too, because, you know, there's this impression that if the FDA doesn't agree, you just absolutely cannot have this treatment. But you talked about the Helsinki Declaration. Tell us a little bit about how people could learn more, and if they wanted to, how they could try this out.
Yes, everybody has the right to be treated however they want to be treated. And there's the Helsinki Agreement, who stated in 1967 that if you're in a critical situation and the world of the medicine doesn't give you a solution for your problem, and we as doctors have found something that can help people in this situation, you are able to use it with the medical consent of the patient, and then after they have to demonstrate that it really worked. So it's this declaration that we're under doing these treatments in patients who ask for the treatment with the medical consent. So we're not doing anything illegal.
Fascinating. And, you know, here in America, and my guess is it's similar in Mexico, they're really pushing this vaccine, these experimental shots, really hard. That's the only solution. Everybody needs to go get one. In your medical opinion, should I run out and go get a COVID shot?
By no means. I don't know if I would call it a vaccine. It's just an experimental injection which has EUA authorization. It's emergency use authorization. It has in phase 3 is experimental phase, so we don't know nothing about what this is going to cost in time. So I would never advise, by no means, to get injected with this substance.
Doctor, it's just it's a pleasure to speak with you. Tell us one more time, what's the website where people can go to learn more about chlorine dioxide? And this is international. Anybody from any part of the world can go to this website?
Yeah, definitely. It's comusav.com, COMUSAV.com. And you can also find a lot of information at andreaskalker.com. That's the official webpage of Biophysic Andreas Kalker, who was the inventor of CDS. And there's information not only for COVID, but for many other pathologies.
Excellent. Well, Dr. Manuel, thank you so much. Folks, that was Dr. Manuel Aparecio Alonso. He is from Mexico. He's treated thousands of patients, and he says he's had phenomenal results that just, blow way past anything we've heard about with ivermectin or hydroxychloroquine or anything else. So go check it out. The FDA has been wrong many times before, and at this point, if you're not suspicious of the big pharmaceutical companies, I think you're just simply not paying attention. I'm Alex Newman. Thanks very much for watching, and stay tuned for more. Thanks and God bless.